Hello everybody, I am your instructor in this course. I am Dr. It's a fascinating field that develops into the microscope world of cells. Microscope world of cells, tissues, and organs. It's essentially the microscopic anatomy of biological structures, offering deeper understanding of how their structure influences their function. Structure and function, very important to know structure before exploring the function. Here is a summary of what histology is all about. What's studied? Microscopic structure histology focus on the minute details of cells, tissues, organs, visibly visible only through a microscope. Microscope is our tool to explore histology. This includes the arrangement of cells and their shapes, sizes, internal components. Imagine a world where you can shrink down to the size of the cell and explore the inner working of the tissue. Histology allows you to do just that, revealing a hidden universe of beauty and complexity. Here are some key aspects of the histology. Microscopic anatomy. Histology focuses on structure too small to be seen with the naked eye, typically ranging from 1 to 500 micrometer in size. This requires the use of powerful microscope, allowing us to see the intricate detail of cells and tissues. Staining techniques. Staining techniques, histologists use various staining techniques to highlight different components of the cell. These stains, cells and tissues, these stains like hematoxylin and iodine, add color and contrast to the tissue, making it easier to identify different structure under the microscope. Cell organization histology examine how cells are arranged within a tissue, forming specific pattern and structure. These patterns often reflect the tissue function, such as the tight packing of epithelial cells in the skin for protection. Tissue type histology classifies tissue into 4 main categories. Epithelial cells, epithelial tissue, connective tissue, epithelial tissue, connective tissue, muscle tissue, and nervous tissue. Each type has unique structure and function adapted to its specific role in the body. Medicine histology is essential for diagnosing disease, and many disease cause characteristic change in tissue structures. Examining tissue sample under the microscope can reveal the presence of abnormal cells, inflammation, and other signs of disease. Research. We use histology in medicine. Diagnosing diseases can cause changes in cells and tissues, like cancer cells. Cancer cells is different under the microscope other than the normal cells, and we can reveal the carcinogenicity characteristics of the cell under the microscope. Research histology is a powerful tool for understanding how tissue function in health and disease. Researchers use histological techniques to study the effect of drugs, investigate the development of diseases, and explore new therapeutic approaches. Education. We use histology in educations. Histology is a fundamental subject in medical and biological science, providing students with deep understanding of how tissue are organized and how they function. Thank you. Join me in the course. I will be happy to explain these topics. Thank you. Categories of tissues. epithelium, connective tissue. Categories of tissues: epithelium, connective tissue, muscle, nervous tissue. Epithelium lines, covers, and protect other tissues and organs, characterized by cells tightly joined together. The presence of a cell secretion called the basement membrane, named by cell shape. Other characteristic of the cells: squamous, cuboidal, columnar. Squamous, cuboidal, columnar. Squamous epithelium cells very thin, much wider than they are thick. Simple squamous epithelium, air sac, found in air sacs of respiratory system, lining of the blood vessels, heart, lymphatic tubes. Stratified squamous epithelium in the skin, vagina, esophagus, and mouth. Example of simple squamous epithelium: the single layer of the cell layer of simple squamous epithelium, as we see here. A stratified squamous epithelium under the microscope after staining with metaxillium and biopsy. Cuboidal epithelium found here. Cuboidal epithelium cells cube shaped, secretion and absorption, found in kidney tubules, in duct and small glands, in surface of the ovary. Columnar epithelium, elongated cells, much longer than they are wide. Simple columnar epithelium, the simple columnar epithelium. This is its appearance under the microscope. A single layer of cells that line the digestive tract, gallbladder, excretory duct of some glands, has microvilli at surface for absorption. Pseudostratified ciliated columnar. Pseudostratified ciliated columnar. Here we find pseudo means not true, not right. Pseudo stratified ciliated columnar epithelium lines the bronchi, trachea, uterine tubes, some of the uterus, people mucus, propel mucus or reproductive cells by ciliary action. Nervous tissue cells specialized to polarize and depolarize cells is nervous. Tissues. Tissue, a definition: a group of connected, interdependent cells that cooperate to perform a specific function. It's a group, connected, interdependent, cooperate, perform specific function. Categories of tissues: epithelial tissue, connective tissue, muscle tissue, nervous tissue. Epithelial tissue general features: cellular layer, basement membrane. Here we find the basement membrane, the stratified transition. Epithelial tissue general features: cellular layer, basement membrane. It consists of cellular layer, no direct circulation or blood supply. These tissues touch each other's rapid rate of cell reproduction. Structure classification: cell shapes. This is the different types and shapes of the cell, the individual cells: squamous, cuboidal, or columnar. Epithelial tissue structure classification: this the cell shape, cell layer. Here we find the simple squamous, simple cuboidal, simple columnar, simple transitional types. Simple squamous epithelium, simple squamous epithelium, and the alveolus and the air sac inside the lung. Simple squamous epithelium in the alveolus, in the air sac. Function exchange, sample location. This is the squamous epithelium in the simple squamous epithelium in the alveoli in the air sac. It's a function exchange of gases. Stratified squamous. Stratified squamous epithelium function protection, simple cage, skin, mouse, reproduction tract. Simple cuboidal epithelium function absorption or secretion is the sample location in the kidney and for hormonal glands in hormonal. Simple columnar epithelium. This is the microvilli here. Sample location digestive tract. Simple columnar. Dot the globular cells. Pseudo stratified columnar epithelium. Pseudo stratified columnar epithelium. Here the cilia and this specimen. Pseudo-stratified columnar epithelium, the function, absorption, secretion, move, the sample locations in the respiratory or reproduction ducts. Transitional epithelium, functional, stretchability, it has the ability to stretch, sample location, urinary bladder, give the urinary bladder the ability to be filled with urine, and you can keep this urine and you can go the bathroom at later time. What kind of tissue is it? It's a squeeze. What type of epithelium that line cavities site on lamina propria support epithelium binds epithelium to other tissue. This function support the epithelium, bind the epithelium to other tissue, provide nutrition. Side of cells are named basal, apical, lateral. The sides of the cells: basal, apical, lateral. Apical is the free part, the lateral, and basal. The basal is the downside, and the lateral is in the outer. Basal lamina propria. Basal lamina propria. Intercellular junctions. This is the microvilli. This is the placenta. Belts that circle cells, tight junction act as a barrier. They provide for adhesion of one cell to another. Here the junctions. The gap junction, هنا desmos, zona occludens, zona adherens, microvilli, intercellular junction. It's built a tight junction as a barrier. Easy to provide for adhesion of one cell to another. It's easy. Spots like a spot welding gap allow passage of chemical for communications. These spots can give the chance to chemicals to the physiology to okay. Say the gap junction. A specialization of the cell surface. Some cells take others function rather than support. Microvilli found mainly on absorptive cells, brush border, cilia, flagella, cylindrical motile structure from 5 to 10 micrometer, contain microtubules, basal bodies. This is microvilli, apical region of the intestinal epithelial cells, seen in this section. Microvilli here appear under the microscope. This is filament that constitute the core of the microvilli are clearly seen, and the extracellular cells core is bound to the plasma of the microvilli. Tissue categories: connective tissue, characterized by the cells widely separated from each other in a matrix that's produced by these cells. Tissue protect and support cell matrix composed of two regions: ground fibers, liquid, solution, gel, gum, or solid. Fiber, non-elastic, white or collagen, elastic, yellow fibers. Types of connective tissue: loose connective tissue, dense connective tissue, adipose tissue, cartilage, bone, blood. Loose connective tissue, gel-like ground with both elastic and non-elastic fiber running through the ground in many directions. Wrap and Cushing organ under the skin. Dense regular connective tissue, nuclei and fiber arranged in parallel row, tendon and ligaments. Fiber mostly non-elastic. Adipose fat function as a storage of cells for adipose lipids. Adipose cells contain large vacuole which in the liver cell contain lipids. Cell nucleus and cytoplasm are pushed out to the edge of the cell membrane. Ground of matrix is gum-like. Cells are found in lacunae within the matrix. Fiber may be elastic or non-elastic, or a form of non-elastic called reticular. Hyaline cartilage, example, the ends of the bone. Elastic cartilage, ear cartilage, example. Non-elastic, the nose cartilage. Hyaline cartilage under the microscope. Elastic cartilage under the microscope. Bone, ground of matrix, is solid calcium carbonate, has blood supply and nerves running through the Harverian canal. This is the Harverian system. Osteocyst and central canal, Harverian canal, Epithelium. Vascular tissue, blood, liquid matrix, plasma, 90% water, 10% plasma, protein, electrolyte, hormone, oxygen. Formed element, erythrocyte, 48 billions for female, 54 billion for male per ml of blood in human. We consider the blood as a tissue. In histology, mammals are enucleated, while rest of the vertebrate they have nuclei. Leukocyte about 7.5 million per ml. Platelet responsible for blood clotting. This is blood, erythrocyte, leukocyte. This is platelets. Muscle tissue, tissue with cells having fibers specialized for contraction. Skeletal muscle, striated, voluntary, parallel, elongated cells, multinucleated, and each cell is the length of the muscle. Light, mid, dark mid, slow twitch, fast twitch. Smooth muscle, visceral, involuntary. Cells are elongated and tapered, organized into sheet of muscle. Cardiac muscle, intercalated, disc, myogenic, branched. This is skeletal muscle under microscope, smooth muscle under microscope, cardiac muscle. Nervous tissues, cells specialized to polarize and depolarize. Cells is in neurons. This is the body of the neuron, the axon. Thank you. The circulatory system, the histology of the circulatory system. Elastic artery, notice the elastic lamina in the tunica media. Elastic lamina. Tunica adventitia, small blood vessels. This is the internal elastic lamina. This is the endothelium from inside. Adventitia, tunica media. Artery wall, this is the artery wall. Section, cross section in the artery wall. Tunica media, lamina propria, endothelium, external elastic media. Muscular artery, the small blood vessels, the tunica media, internal elastic lamina, and the tunica adventitia. Muscular artery, this is muscular rear. Muscular artery, internal elastic lamina. The artery, other vein, artery vein. Here the small arteries, internal. Muscular artery. Here the muscular rear. Here we are found the lumen of muscular artery, muscular internal elastic lamina. Here the lumen of the artery, other layers, artery, small artery, tunica media, internal elastic lamina, adventitia, internal elastic lamina, smooth muscle layer in the arteries, arterioles, lumen less than 0.3 millimeter in diameter, thin tunica intima, endothelium, little collagenous support tissue, thin IEL, tunica media, tunica adventitia, arteriole and venule, capillaries, diameter 3 to 40 micrometer, endothelium, continuous, discontinuous, either continuous or fenestrated, capillaries, epithelium, microcirculation, fenestrated capillary, artery and vein, the difference between artery and vein, tunica intima, veins, tunica intima, little more than endothelium, tunica media, thin layer of smooth muscle, tunica adventitia, thickest layer, vein, a little of everything, lymphatic capillary, smooth muscle cells, lymphatic vessels, arterioles, venules, atherosclerosis, plaque in the coronary artery. Atherosclerosis lesions, focal thickening of the intima, proliferation of smooth muscle cells, increased deposition of CT fiber, connective tissue fiber, lipoprotein, macrophage engulf lipoprotein, become foam cells, thickening occlusions. The digestive system histology, the small intestine, villus, introside, brush border, cryptus of lubricum, upper glands, spire patches, plaque circularis. Here we find the duodenum, renal glands, pyloric region of the stomach. Here, pyloric region of the stomach, or the pyloric sphincter, duodenum, gastroduodenal junction, plica circularis, ileum bar patches, the bar patches, duodenum, X20, small intestine, X2, small intestine, Werner gland, intestinal gland, crypt of lubricum, goblet cells, crypt contain epithelium, villus, cryptus, villus, enterocytes, small intestine, ileum circularis, small intestine, crypts. Here, cryptus. The colon, mucosa with cryptus, glands consists of absorptive cells and mucus secretion cells. Muscularis propria is very pronounced. Longitudinal muscle occurring in 3 bands, tuniaculi, other than completely surrounded tract. The colon 12, large intestine, colon crypts, large intestine crypts. Histology of respiratory system, pulmonary arteriole, blood flow, capillary network of the surface of the alveolus, blood flow, pulmonary venule. This is the unit of exchange gases: pulmonary arteriole, pulmonary venule. Here the capillary network of the surface of the alveolus. Function of respiratory system: get air into and out of the body and allows gas exchange. Conducting portion: nasal cavity, nasopharynx, larynx, trachea, bronchi, bronchiole, terminal bronchioles, warm, moisten air, warms and moisten the air. Respiratory portion: respiratory bronchiole, alveolar duct and the alveoli. Gas exchange occur. Main division of the respiratory tract: here the trachea, the primary bronchus, the secondary bronchus, bronchiole, terminal bronchiole, alveolar sac. Layers of the wall: mucosa, epithelium, lamina propria, smooth muscles, submucosa, dense irregular CT, glands often present, adventitia. Respiratory epithelium in the conducting portion: ciliated columnar cells, mucous goblet cells, brush cells, sensory receptors, basal cells, generative stem cell that replace other cells, small granule cells produce biogenic amines, paracrine and cells. Respiratory epithelium: ciliated cells. Respiratory epithelium: ciliated cell, goblet cell, mucus production, connective tissue. Ciliated columnar cells, cilia, basal bodies, junctional complex, mitochondria. Surface of the respiratory mucosa: goblet cells, ciliated cells, brush cells, small granules, electron micrograph of cell of the diffuse neuroendocrine system. Note the accumulation of secretory granules in the basal region of the cell. The Golgi complex seen in the upper part of the micrograph shows some secretory granules. Turbinate, nasal passage. Here the sagittal section in the skull. Turbinate, nasopharynx, pharynx, nasal cavity, nasal bone, nasal cavity, vestibular, outer nasal area, keratinized epithelium, transition to the respiratory, short hair filter, nasal fossa, respiratory epithelium, swell bodies, counter current flow to warm air, olfactory epithelium, nasal mucosa epithelium, mucous gland of lamina propria, serous gland of lamina propria, thin walled venules, olfactory mucosa. Here the olfactory cells, support cells, Bowman's gland, axons, sinus, frontal sinus, isthmus, sigmoidal sinus, the maxillary sinus. Epithelial lining of the sinus: thinner respiratory epithelium that contain few goblet cells. Respiratory system: here the larynx, trachea, left superior lobe, left inferior lobe, right primary bronchus, secondary bronchus, tertiary bronchus, terminal bronchus, right inferior lobe. Respiratory system: larynx, trachea, left superior, left inferior, right superior, right primary, secondary bronchus, tertiary bronchus, terminal bronchus. Epiglottis, cartilage, hyoid bone, thyroid cartilage, cricoid cartilage, trachea, hyoid bone, epigenetic cartilage, corniculate cartilage, arytenoid cartilage, trachea, larynx, trachea, lumen of the trachea, hyaline cartilage, ciliated epithelium, smooth muscle, and connective tissue. Trachea, pseudo-stratified epithelium, pseudo-stratified ciliated cells, and the mucous cells are the two major components of the epithelium. Cilia beat at 1000 to 1500 cycles per minute, resulting in movement of the mucous blanket at 0.5 to 1 mm per minute in a small airway and 5 to 20 mm per minute in the trachea and the main bronchi. Pseudo-stratified ciliated cells and microscopic cells are the two major components of the epithelium. Cilia beat at 1000 to 1500 cycles per minute, resulting in movement of the mucous blanket at 0.5 to 1 mm per minute in small airway and 5 to 20 mm per minute in trachea and main bronchi. Trachea X14 under the microscope, the high power, the nucleus and the trachea, the goblet cells, viscous mucus, connective tissue, serous gland, fluid secretion, precondium, cartilage, mucous gland in upper respiratory tract, trachea X10, low power, trachea low power, gland of trachea high power. Thank you. Bone, the most amazing story of bone histology. Function of bone: support of soft tissue, protect vital organs, cranium, thoracic cavity, contain bone marrow, reservoir of calcium, phosphorus to maintain constant concentration in body fluid, allows body to move, specialized CT cells, osteoblast, osteocyst, osteoclast, bone matrix, classified material lacunae, and more, caniculi, periosteum, endosteum. Anatomy of the long bone: articular cartilage, here articular sponge bone, space containing root marrow, endosteum, compact bone, medullary cavity, yellow marrow, periosteum, epiphyseal plates, proximal epiphysis, this diaphysis, this distance, diaphysis, and distal epiphysis, This is the femur. Osteoblast, size organic component of matrix, collagen, type 1, protoglycan, glycoprotein. Collagen form osteoids, stand for spiral fiber that form matrix. In fluid, deposit of calcium and phosphorus, active versus inactive osteoblast. Estrogen, BTH, stimulate activity. Osteoblast, this is its appearance. It's a diagram. Osteocyte, mature bone cells that sit in lacunae, gap function between osteocysts, provide nutrition, 15 cells in a row, maintain bony matrix, long-lived cells, stimulated by calcitonin, inhibited by BTH, parathyroid hormone. Osteocyst with cytoplasmic extension, osteocyst with caniculi. This photomicrography of dried bone, ground very thin, the lacunae and the caniculi filled with air, defect light and appear dark, showing the communication between these structures through which nutrient derived from blood vessels flow, medium magnification. Osteoclast driven from the monocytes engulfed bone material Active osteoclasts stimulate osteoclast activity. Large branched motile cells secrete enzyme that digest the matrix. Bone resorbing osteoclast developing medullary cavity. Osteoclast, bone, osteoclast. This is bone. Bone resorption. This is the process. Secretion of calcium, pharyngeal clear zone, body blood capillaries, microenvironment of low pH, lysozymes. This is nucleus, osteoclast, bone matrix. Remodeling. On this image, the deepest red color is bone, while pink represent either fibrocartilage, collagen within cartilage, or mineralized cartilage. Here the cartilage, osteoclast, osteoclasts. This is bone. Invasion of bone into classified cartilage. Osteoclasts are laying down new bone toward the left of the upper boundary of this cavity. Osteoclasts are removing previously from bone. Remodeling. Bone replacing cartilage. This fibrocartilage. Osteoclast, classified cartilage, osteoclast. Remodeling bone. Osteoclasts, and this is the bone matrix. Endochondral ossification. The previous photograph in the upper region is a row of osteoclasts with intense cytoplasmic mesophilia, a feature to be expected in cell-sensitized glycoprotein collagen. Note an osteoclast being captured in the bone matrix. Between the layer of osteoclast and the classified bone matrix is a bare region made of non-classified bone matrix called osteoid. Endochondral ossification. Periosteum, mesenchyme, fibroblast, osteoprogenitor cells. Mesenchyme, fibroblast, osteoprogenitor cells. Compact bone. Epiphyseal of the femur. Skull bone, spongy bone, compact bone. This is a compact bone. Endosteum, nerve, blood vessels. The red is blood vessels. Compact bone. This is spongy compact bone. This is pores. Osteoionic canal containing vessel and nerve. Osteoionic canal, nerve, osteonic canal, blood vessels. Osteon, long cylinder parallel to long axis of diaphysis, consists of Harversian canal with nerves, blood vessels, lamellae with osteocyst. Harversian canal communicate with mouth cavity, periosteum, other canal through Volcom canal. Compact bone, osteon. This is the caniculate between osteocyte. Endochondral bone development. The cartilaginous model, calcified cartilage, compact bone, secondary ossification, medullary cavity, secondary ossification center, compact bone, epiphyseal disc, medullary cavity, and the sponge bone, articular cartilage, medullary cavity.